Health. Our keynote speaker, the Director General of the World Health Organization, the chairs and members of the boards of Uganda Cancer Institute and the Palliative Care Association of Uganda, conference delegates who are online, in the studio here and on TV. Ladies and gentlemen, good morning, everyone. You're most welcome to this special international conference. My name is Dr. Eddie Mwebesa. I am a palliative care doctor. I'm also the Director of Clinical and International Programs at Hospice Africa, Uganda. The last 2 years have been very, very atypical. They have been very unusual. And this third conference on cancer and palliative care talks about how atypical these last 2 years are. So it is not surprising that the theme this year is cancer and palliative care in COVID-19 and other challenging situations. So you are most welcome, and we hope that you will have a good conference. I have the privilege of chairing this conference with my colleague, Dr. Innocent Mutiaba, and I will kindly ask Dr. Mutiaba to come and give us a preamble to the conference. Thank you very much.
Thank you, Dr. Eddie. Our distinguished guests, ladies and gentlemen, you're welcome to this third conference, Uganda Conference on Cancer and Palliative Care. My name is Dr. Mutiaba Innocent, as already introduced. I work with the Uganda Cancer Institute, and I am the co-chair for the conference. I'll take this opportunity to orient you to the purpose of the conference and our program for today. The Uganda Conference on Cancer and Palliative Care is an event that we hold once every 2 years. It is co-hosted by Uganda Cancer Institute and the Palliative Care Association of Uganda. The objectives of this conference are generally 4. The first is to showcase cancer and palliative care research that has been conducted in the intervening 2 years, to share strategies for standardizing of care for cancer patients across sub-Saharan Africa, and the third, to document resources available for care, research, and training in cancer and palliative care, and finally, to promote collaborative work on cancer and palliative care in the areas of care, research, and training. Our first conference was held in August of 2017, and the theme was United Against Cancer, Prevention to End-of-Life Care. It coincided with the 50th anniversary of the Uganda Cancer Institute and was attended by over 300 delegates. And the second conference was held in 2019 September under the theme Towards Universal Coverage. It coincided with the celebration of 20 years of palliative care advocacy in Uganda. The conference was graced by 350 delegates from 8 countries all over the world. We are gathered today for our third Uganda Conference on Cancer and Palliative Care under the theme of cancer and palliative care in COVID-19 and other challenging situations. Our deliberations will focus on 4 sub-themes. The first being innovation and creativity. Second is providing care to the vulnerable populations. And the third is sustainability of cancer and palliative care services in Uganda. And finally, the fourth will be resilience, caring for the caregivers, and sustainability of services in challenging situations. Thank you. That is the preamble to our conference. And as I will begin, I will take this opportunity, therefore, to invite our first speaker, Dr. Jackson Rem, to give his opening remarks on behalf of Uganda Cancer Institute. Dr. Rem is a medical oncologist and executive director of Uganda Cancer Institute. Dr. Rem is a graduate of Macquarie University, Case Western Reserve University, Cleveland, Ohio, and Karolinska Institute in Stockholm. Dr. Rem has led UCI through several transitions, including the modernization and expansion of cancer services in Uganda, and the establishment of the East African Center of Excellence in Oncology at UCI. He's a principal investigator on several international studies and has received several NIH-supported research projects and is a recipient of several industrial-supported grants. Dr. Rem represents Africa on the ASCO International Affairs Committee and is an active member of several international societies, including the American Society of Hematology and the Society for Immunotherapy of Cancer. Dr. Rem, you're welcome to give us your opening remarks. Thank you very much.
Thank you very much, Innocent, and good morning, conference participants. I want to take this opportunity on behalf of the Uganda Cancer Institute to warmly welcome you to this third conference on cancer and palliative care. And I want to say that this is really an indicator of how much we can do together, even when we are faced with adversity. And I think the COVID situation is a very good indicator of the adverse situation through which some of our services are delivered. But the fact that we can have this conference at this time shows that when we work together, nothing actually can deter us from achieving our objectives. And in this regard, I want in a special way to acknowledge the collaborative spirit with which we have worked with the Palliative Care Association of Uganda over the years. And it looks like every time when we're having this conference, things seems to be just getting better and better. I also want to appreciate our government, the government of Uganda, our mother ministry, the Ministry of Health, for the continued support that they have been giving to both palliative care and cancer care in this country. The main aim of working together with collaborators like the Palliative Care Fraternity is just to demonstrate that at the end of the day, the enemy is one. And actually, when we combine our resources, we combine our abilities, then we are able to overcome. And then secondly, we as the Uganda Cancer Institute really value the input that the Palliative Care Fraternity provide in the fight against cancer. I always say that cancer is a formidable enemy, and there is no other disease that can actually demonstrate how best you can handle a very, very complicated situation than cancer. But when we combine or we work together with other actors who are actually also facing the same objective, then we are able to achieve even much more than if we do it alone. And the second point is actually to make sure that palliative care is understood in the first instance and mainstreamed. And there is no better disease entity that can demonstrate how that can be done than cancer. And I'm very, very glad that the Ministry of Health has taken this very seriously. There are very many policy initiatives that is geared towards this aim. And I hope this conference will provide some of the needed ingredients for that, from research, from experience, that actually can be adopted and later on mainstreamed into the policy in this country. I want to thank you all, those who are watching from both within and without, using social media, using other means. This is a virtual conference, but I'm very happy that the attendance is good, and that demonstrates actually the spirit of the conference, that even in adverse situations, I don't think we can be defeated if we are united. Thank you.
Thank you very much. Thank you very much, Dr. Rem, for those remarks. The cancer and palliative care are one and the same, and we are glad that Dr. Rem has reiterated how important both services are to patients. I take this opportunity now. Let me take this opportunity to invite MacDonald Mwesiga, who is the country director of the Palliative Care Association of Uganda. The Palliative Care Association of Uganda is the national association that brings together all members, institutional and individuals, who believe in the cause of palliative care. He has a master's in public health and also in management studies. And it is my honor to invite him to this podium to give his remarks.
Thank you so much, the chairs of the conference, our chief guest, the Prime Minister of Uganda, the Minister of Health, Dr. Tedros, the Director General of World Health Organization, the conference co-chairs, the chair of the board of Uganda Cancer Institute, Dr. Jackson Orem, the ED, UCI, Dr. Henry Dungu, the chair of the board of the Palliative Care Association of Uganda, all conference speakers, the presenters, all of you delegates of the third Uganda Conference on Cancer and Palliative Care, those here, those on TV, and those at the 15 satellite facilities in the country. I welcome you all to the third Uganda Conference on Cancer and Palliative Care. I add my voice to the ED of UCI to thank the organizing committee for going through the uncertainties of COVID-19 and to make sure that we have a conference. It's already been mentioned that this is the third time that we are having this conference, and as the Palliative Care Association, we are grateful and we appreciate the commitment of the leadership of the Uganda Cancer Institute for maintaining this partnership. Palliative care is key to universal health coverage. It is actually target 3.8 of the Sustainable Development Goals. We cannot talk about UHC without palliative care. The World Health Organization has stated that over 40 million people require palliative care annually in the whole world, and 78% of these people live in the middle income and in a low income countries like ours. Right now in Uganda, we know that access to palliative care services is still very low. We know that slightly over 11% of all those who need this service receive it. The records of the Palliative Care Association of Uganda show that currently there are at least 226 health facilities which are accredited to offer this service in the country. And these are hospitals mainly. There are about 107 districts in this country which have a palliative care service or a trained palliative care service provider in there, and the hospital has been accredited to offer the service. And in Uganda we have 146 districts. This leaves about 30 districts without this form of care. The government has done a lot, and we have been hailed as a country as a model for palliative care in Africa. Recently, the ministry has done a lot to establish a division of palliative care, and we thank them. We also thank them for continuously paying for essential medicines for palliative care that are listed in the essential medicines and medical supplies list. In March this year of 2021, the Director General of Health Services issued a directive to all hospitals to establish palliative care units. We commend the ministry for this effort. But we say that there is much more to be done. We appeal for the passing of the National Palliative Care Policy, for the increased investment in the palliative care services of this country, for the recognition of palliative care specialists who have trained and are working in the civil service structure but not deployed and remunerated as such. We appeal for more government investment in the coordination of the service, into training and into research. The COVID-19 pandemic and the lockdown that came and restrictions that were imposed to mitigate the spread of the disease had an impact on hospice and palliative care services in the country. And a number of hospices and palliative care organizations had to restructure and to make sure that we continue offering the service. We thank you, all health workers who have been at the front line to ensure that Ugandans are saved, and we commiserate with all families that had their loved ones pass on due to this pandemic. We thank the President of the country who came out strongly to say that district health officers should care for the plight of palliative care patients in communities. During this conference, members of the public will participate. It is the first of its kind that we're having members of the public who will be following on UBC TV and on other media stations, plus on social media. I would like to appeal to members of the public to use this opportunity to engage with the specialists who will be presenting to you, because we have done this in view of making sure that the public participate and receive information about cancer and palliative care. I would like to end by thanking all people who support the work of palliative care and cancer in this country, and appeal to all of you who are listening to me and those who are viewing on TV that you can support the work of the Palliative Care Association of Uganda in different ways. But the biggest that I have put here is that all of you listening to me can reach us, and you can become our members, because palliative care is everybody's business. I thank you for listening to me and wish you very good deliberations during the conference.
Thank you very much, MacDonald Mwesiga, for those kind remarks and for your address to the viewers and to the listeners here. Thank you for highlighting the central role of palliative care. Everyone understands, of course, what cancer is, but palliative care sometimes has not always been understood. So palliative care is an active form of care, an approach to patients who have serious illnesses like cancer. And we ensure that we attend to the physical, psychosocial, and spiritual domains of patients. And our focus, of course, is quality of life of patients and their families. So I want to thank you very much, MacDonald Mwesiga, for those remarks. It is now my honor to introduce our keynote speaker. Our keynote speaker is the Director General of the World Health Organization. Dr. Tedros Adhanom is with the World Health Organization, appointed as a Director General in 2017. He's an Ethiopian and the first African in this role at the WHO, endorsed by the African Union. He served as the Minister of Health in Ethiopia from 2015 to 2012, and the Minister of Foreign Affairs from 2012 to 2016. And he was also recognized by the Time magazine as one of the 100 most influential people in 2020. Of course, 2020 is a turnaround year for us because the World Health Organization declared COVID-19 as a pandemic. So Dr. Tedros is not able to be here physically with us, but he has an address which he has that he's going to deliver to people online and on TV. Thank you very much.
Your Excellency, the Right Honorable Robina Nabanja, Prime Minister of the Republic of Uganda, Your Excellency, the Honorable Minister, Dr. Jane Asenja, dear colleagues and friends. The COVID-19 pandemic has badly disrupted cancer control around the world. Fewer people with cancer are seeking and receiving cancer care, and prevention measures like HPV vaccination and cervical cancer screening programs have been interrupted. I congratulate Uganda for finalizing your national cancer plan and for using innovative approaches to maintain essential services. You also have a leading role in palliative care in the region, especially regarding capacity strengthening and access to medicines. WHO has taken many steps to support countries to improve cancer globally, including access to palliative care with special attention to vulnerable groups. In the coming weeks, we will issue new technical documents to help countries to assess the quality of palliative care services. The COVID-19 pandemic is a powerful demonstration of why universal health coverage must remain our top priority, built on resilient health systems that can continue to deliver essential health services for cancer care, including palliative care, even in the most severe crisis. I wish you a very productive meeting, and I thank you. Sante sana.
Thank you for that address. Ladies and gentlemen, as we move forward with our program, as we've already indicated, the previous 2 years since our last conference have been challenging with the COVID-19 situation, but the care of patients had to continue, and both organizations, that's Uganda Cancer Institute and the Palliative Care Association of Uganda, continue to care for patients even during this time of lockdown. We take this opportunity, therefore, through the two organizations to recognize an individual and an institution that has greatly participated in ensuring that we continue to provide services for our patients. I would therefore now request that we play the citation from Uganda Cancer Institute for the awards.
UCI Individual Award at the 3rd Uganda Conference on Cancer and Palliative Care will go to an individual who has demonstrated outstanding effort for the continuity of cancer care to patients in the country. This goes to someone who has continued to offer support towards feeding children with cancer and rallying different individuals and organizations for the same cause. He lost his wife to cancer, and since then, he has decided to keep supporting the Uganda Cancer Institute reach out to cancer patients. This award goes to Mr. Matovu Waswa, a swimming coach at Malta Swimming Club.
Mr. Matovu, you're welcome to receive your award. The minister. The minister. Okay. So we shall ask the Dr. Rao to just recognize. Just recognize him from there. Come forward. Just come. Give it to the minister. Yes.
So, on behalf of the organizers of the conference, Uganda Cancer Institute, and the Palliative Care Association of Uganda, on behalf of the Ministry of Health and the Government of Uganda, I take this pleasure to give this award in recognition to Mr. Matovu Waswa for his continuous support towards feeding with cancer children and rally different individuals and organizations for the same cause. And he will receive this award today on the 3rd conference. Congratulations.
Minister, if you can stay here with me, please. Yeah. All right. Excellent. All right. Thank you so much, Minister. We now play the citation for the institution nominated by UCI.
The award for this year goes to an institution that has greatly contributed to the fight against cancer in the country. This institution has continuously made donations to children with cancer, supported cancer awareness campaigns, and has continued to mobilize resources for the fight against cancer. They donated a patient waiting shed at the Uganda Cancer Institute to enable patients and their caregivers to have a decent and safe place to rest as they secure treatment. The UCI Institutional Award at the 3rd Uganda Conference on Cancer and Palliative Care goes to DFCU Bank.
Let's receive the representative from DFCU Bank, please. Come and receive this award. Just hand it over.
I have the honor to present this award in recognition to DFCU Bank for their contribution to the fight against cancer. Through your donation, this has definitely touched many lives, supporting cancer awareness campaigns, donation of patients waiting shed, and mobilizing resources for the cancer fight. Congratulations.
So we shall proceed to receive citations from the Palliative Care Association of Uganda and the individual they have nominated.
The individual award at the 3rd Uganda Conference on Cancer and Palliative Care will go to a palliative care provider who has demonstrated outstanding effort for the continuity of care to patients and families amidst the COVID-19 pandemic. At the height of the lockdown, palliative care providers stepped out of their comfort zones for the benefit of patients and families under their care. Palliative care providers innovatively utilized telephones, social media, and border borders to ensure continued care. The providers offered comfort and reassurance to many under their care. They advocated and made sure that the patients' voices were heard at local and national leadership levels. They demonstrated a high level of compassion for those in need. One such individual is a palliative care nurse working in a rural district hospital in southwestern Uganda. She is Sister Catherine Nakasita, a senior assistant nursing officer at Chitagata Hospital.
It's my pleasure to hand over this award on recognition to Catherine Nakasita, a provider, for her outstanding service towards the continuity of palliative care amidst the COVID-19 pandemic. Congratulations.
Excellent. So finally, we shall have the institution nominated by Palliative Care Association of Uganda. Their citation, please.
The COVID-19 pandemic has affected the smooth operations of hospice and palliative care organizations in Uganda. Hospice and palliative care organizations have had to be innovative and to restructure operations in order to thrive. When the first confirmed COVID-19 death was announced in Uganda, the death had happened at a hospice facility. This brought a spotlight to the work of palliative care in Uganda. The staff at the hospice were put under institutional quarantine for over 14 days. They faced psychosocial distress mainly because they were concerned about their patients who were out of care during this period. Once the quarantine was lifted, the hospice did everything quickly to fit the standard operating procedures. The hospice opened doors to continue serving. They have seen over 10,000 patients in the last 1 year. That is 830 patients per month. And of these, there are approximately 60 active palliative care patients on oral morphine each month. The hospice has demonstrated outstanding resilience. The Institutional Award at the 3rd Uganda Conference on Cancer and Palliative Care goes to Joy Hospice Mbale.
I take the pleasure to hand over this award in recognition to Joy Hospice Mbale for their outstanding service towards the continuity of palliative care amidst the COVID-19. Congratulations to Joy Hospice Mbale.
I'll request you to just resume your seat. Thank you. All right. Thank you.
There was another citation by Tom Dupe.
Okay. You want to introduce it? Okay. Thank you.
Ladies and gentlemen, thank you for how far you have come, and a big congratulations to the awardees, the individuals and institutions who have been recognized for their exemplary role and going the extra mile to offer services despite all during COVID. Ladies and gentlemen, in the fight against COVID and in an effort to control it, of course, this country has not gone unscathed, and we all know that the figures that were statistics in the distant past actually manifested at the end of the day into names that we know very well. And I believe there's no family that was not affected by COVID-19. So I would like to call upon one particular tribute to be given for someone who was exemplary for palliative care and for cancer care, and offered quite a lot of his time and expertise for the service. Mr. Tom Duku was an advocate and a champion of palliative care in Uganda, and we will dearly miss him. May his soul rest in eternal peace. Ladies and gentlemen, I now have the pleasure to invite the individuals who have received awards to come and say a word or two about their work during this COVID-19 pandemic, and also to let us know as a country how it is that they did it. So if we might kindly have and dedicate a few minutes to the awardees to come forward and just say a few words at the podium. Thank you very much. We can, of course, naturally, ladies first. Catherine, kindly make your way, and you're most welcome.
Ladies and gentlemen, I welcome you on the third conference of Cancer and Palliative Care. My name's Nakasita Catherine. I'm a Senior Assistant Nursing Officer, Kitagata Hospital. I just got my promotion early this year after the hard work I had shown to the district in supporting patients with cancer and HIV. The most important thing that I do at Kitagata Hospital, I was the first person after training in advanced palliative care. I was the first person to open a palliative care unit at Kitagata Hospital. Kitagata Hospital is a district hospital in southwestern Uganda, serving all the Greater Bushenyi districts. There are 5 districts. That is Bushenyi, Shema, Rubirizi, Mitoma, and Buhweju. So it's the only palliative care unit in that side serving all the Greater Bushenyi districts. So patients no longer have to go to Mobile Hospice Mbarara for oral morphine and psychological support. We do that at Kitagata Hospital. I have a team of 5 people that I work with, and I'm being supported by the medical superintendent Kitagata Hospital, Dr. Kawishwa Johnson, the Chief Administrative Officer of Shema District, and the District Health Officer. During the COVID-19 total lockdown that was there in April, I was stuck with patients. Patients couldn't come to hospital for treatment. I was very stuck, so what I did, I used to visit patients myself. I used to send drugs to patients using border borders, and they would pay back the transport. So a time reached when the transport costs were so high, I had no option. Then I wrote to PICAO for support. They really had my cry and supported me. So for the whole of the pandemic, patients in Greater Bushenyi continued with palliative care services till now. I thank you so much, PICAO, for supporting me. I thank Hospice Uganda, where I trained from, where Dr. Eddie was our head. I thank my tutors, some of them are here. Thank you very much for training me, and I wish you well for this conference. Thank you so much.
Thank you very much, Catherine. Without a doubt, Catherine exemplifies what going the extra mile means. While many health workers were terrified, and they had reason to be terrified because of COVID, patients at the Cancer Institute, Uganda Cancer Institute, hospices, and in many hospitals continued to receive care courtesy of the bravery of nurses and doctors like Catherine. So I would like to say thank you very much, Catherine. It is an award well deserved, and many congratulations. It is now my honor to invite Mr. Matovu, if you have some words Thank you very much, and please give him a rounding clap as he makes his way to the podium.
Ladies and gentlemen, protocol observed. First and foremost, I must say I was ambushed with this award. However, I'm very grateful. Like it was stated in the introduction, I lost my wife to cancer in 2011 in June. Before that, we spent several months going in and out at the Cancer Institute, and I noticed how patients suffer, not because of inefficiency of the staff, but because of inadequate supply of a number of things. I got very much carried away at that time by the children, because at that time the children's ward was so tiny, extremely tiny. We would see them crossing each other, and many of them were sleeping on the veranda. We would see the caretakers going to look for food. And having noticed that my own wife had gone through the similar challenge, I knew that maybe I could give in something to help the children as they are treated. And my contribution, I thought, would be in feeding. I've taken several years mobilizing my friends, my family, to make sure that we give a continued supplement of food stuff to the children's ward. And as long as I'm still breathing, I think I'll try my best to continue doing what we are doing. I'd like to make one observation, especially during this period of COVID-19. Sometimes I feel so hurt that I am unable to reach the ward because I am not an essential worker. I have the access to getting the food stuff I would like to get to the hospital, but I feel it is not possible to take it because I am unable to deliver it. And I think this is the same plight with the maybe the ward workers who are not medical. I think they should be considered as essential workers because they need to be able to reach the hospital in order to supplement the nurses and the doctors. I would like to thank my friends of Uganda Cancer Institute. Several times I crossed Dr. Rem, Dr. Dungu, Dr. Joyce, Dr. Victoria, and many others. They have been really very welcoming. Sometimes I step on their toes when I'm passing them, but I do it with a loving heart. So please don't get tired of me. Thank you so much.
Thank you very much, Mr. Matovu. Mr. Matovu is a unique person. For someone who has come from such tragedy to open their heart and open their wallet and give donations so freely. That is just simply amazing. This is what care is all about. There are so many people who are suffering today. There are so many people who have nothing. And for us who have something to give, it is so absolutely important that we are generous, particularly because COVID turned around not just Uganda, but this world. I would like to give an opportunity to each of the institutions that have been awarded, and it is my honor to invite Dr. Jane White to say a few words about the hospice that she's representing. You're most welcome, Jane.
Praise the Lord. All protocol not observed. It's a great honour that our institution has been recognised in this way. I first came to Uganda in 1987, and I've been working in Mbale since 1999, and our hospice started in 2000. Of course, there are very many people that we need to thank. I mean, Professor Merriman, of course, for starting palliative care in Uganda, the Ministry of Health for providing the morphine that is such a vital resource for pain relief for our patients. We were quite stressed during the pandemic, particularly as a lady with pneumonia came to our unit when it had not been realised that there was community spread of COVID-19. And of course, she became the first patient with confirmed COVID-19 who had died, which was very distressing. We have continued to work during this period. I have continued to work personally, although I am over 70 years old, and I am very delighted to say that I was allowed to become a citizen of Uganda in December last year. At present, we owe a lot of thanks to APCA and the True Colours grant, because we have been able to buy a motorcycle. Originally, we only had one vehicle, which is now quite elderly, and I was the only driver. So we've now got a motorbike. I have had 2 clinical officers who have both got degrees in palliative care. One has moved up to train to be a doctor. The other one, Dennis, is still with me, and we are delighted that finally we don't have to just use mobile phones, but we can actually visit, not with me on the motorbike, but with Dennis on the motorbike. We can finally visit our patients at home. Thank you very much. I am honoured that we have received this award.
Thank you very much, Dr. Jen, as you are fondly called, from Joy Hospice in Mbale. Joy Hospice, Joy stands for Jesus first, others, and then yourself last. And Joy Hospice has ably demonstrated that they are bringing the care that they have learned from their mentor, Jesus Christ, to the community that they serve of suffering patients in Uganda. Joy Hospice is one of 13 other organizations which are called hospices, which are offering palliative care services in Uganda. And these organizations have been at the forefront of providing services, particularly for patients who are quite unwell, many of whom are too sick and are actually in their homes. So they provide a lot of home-based care, and that is something that is so important in palliative care, especially as patients deteriorate and may reach end of life. So congratulations to Joy Hospice on your award. Finally, it is my honor to invite the representative from DFCU Bank. We know banking as a sector where we take our money, and DFCU has done something exceptional. They have given back to the community and to the suffering in Uganda. So you're most welcome. Kindly come and give your remarks.
Good afternoon, ladies and gentlemen. I'm called Joseph Kasaija, and I'm here to represent DFCU Bank. Who would have been here with my MD, but he got a little bit engaged with other activities to do. But I'm glad that you've given us the honor to be recognized as one of the institutions from the private sector to join this fight. I would also want to applaud the Executive Director for accepting and allowing a banking institution like DFCU, whose core focus in as far as CSR or corporate social responsibility mainly looks at maternal health care, and it was through that kind of engagement that we got in touch with the ED through Dr. Joyce and Richard. So we really had a detailed discussion regarding what we can do to improve on the collaboration that the bank can actually come to join to fight this pandemic, this disease. And indeed, we were given a platform to see how we can offer to support where necessary. One thing that we noticed in our first engagement was the number of patients that were coming from up country, that we noticed that we were lying within the corridors, and all these vagaries of nature were really applying to them, the sun, the rains. And immediately my managing director accepted and said we need to host these people and have a place where they can actually wait from as they are getting their medication. And so that was the first intervention that we thought of, and the bank contributed 120 million shillings to put up the structure, which is now up and running. And I'm sure quite a number of people who are waiting for their medication are getting at least a shelter where they can wait from until they get their medication done. The other area we wanted to support with, which is still ongoing, was to equip and support equipping the bunkers that were being built. And we did a survey and looked around. That is still under discussion, but through our leasing arrangement, we are still looking for ways of how we can support government using your allocated budgets to see if we can equip these machines to ensure that our people get support. The third area that we looked at was to bring in the blend of private sector in as far as making services more efficient. And like you've just heard, our core deliverable is collecting and keeping money. And so we came in with our e-solutions, which became very handy during the pandemic, during COVID, because banks were equally affected like any other institution. However, using our own products, especially agency banking, we went through the period to collect money for Uganda Cancer Institute, and these funds are quite important and relevant for the institution. And as I speak now, the system is working very, very well. Funds are being handled by the bank, and we are leaving the doctors and technocrats to just focus on treating our people. So there is no more worries regarding how do we keep our money properly, safely, and taken to the bank. It is instant on site. So I really want to thank the entire staff and management and the board of Uganda Cancer Institute for recognizing DFCU Bank as one of your key partners, and we pledge to continue to support you where you need our support. Thank you so much.
Thank you, everyone. Thank you for staying with us, our TV audience and the people here. As we proceed and as we await for our guest of honor, it's my greatest pleasure to invite one of our own, Dr. Henry Dungu, who is the chairperson of the PICAO board, but also works with the Uganda Cancer Institute. He represents this intermarriage or intersection between palliative care and cancer. And I'll request Dr. Dungu to give or make his remarks right where he is. Thank you very much.
Thank you very much, members of this conference, and as it's been said, all protocols observed. It's with great honor that we are all here, and as chair of the board of the Palliative Care Association of Uganda, it is really honoring for us to work with the Uganda Cancer Institute to run these conferences. As it was said earlier, we started this at the commemoration of the 50th anniversary of the Uganda Cancer Institute, 50 years of Uganda Cancer Institute, and we agreed that we could have these collaborative meetings going on. It's actually every other year, like biannually. It's very important for us to disseminate our research through such fora that bring us all together, because as you all know, initially palliative care was almost only for people with cancer. When you go back and look at how palliative care was defined in 1990, it was for those people where all efforts of cure had kind of waned off. And they said, okay, if everything has failed, let's do palliative care. Of course, this definition was revised, and in 2002, it was agreed that palliative care should be seen as an approach that helps someone to live quality life. So quality of life still remains the goal. It's not only death. We should not look at palliative care as if it is only end-of-life care. End-of-life care is just a small but extremely important aspect of palliative care. That's why the Uganda Cancer Institute embraces palliative care as part of the entire package for patients' care that we deal with. So in my capacity as a member of the Cancer Institute, as well as chair of the board of the Palliative Care Association of Uganda, I find it really fulfilling that we are working together, because it is helping us to really implement this big goal of ensuring that everyone who has a life-threatening illness, including cancer, is able to achieve the quality of care they deserve. I find it extremely, extremely exciting that we have these conferences going on, and I can assure you, we are going to have the 4th Uganda Conference on Cancer and Palliative Care coming soon, because it's going to continue like this. And I encourage all of you who are doing research to look out for all these exciting innovations that look at cancer and palliative care together, so that we disseminate to the world, so that we create evidence for palliative care, so that people don't only look at palliative care as failure. We need to make sure that we educate the general public, because many people have failed to accept palliative care, thinking that it is only for those who are just about to die. But palliative care can help improve your quality of life, and you live, and you don't even die. But if you're to die, we'll accept that as a normal process. So with those few remarks, I want to thank you again, and to congratulate you both, Uganda Cancer Institute and the Palliative Care Association of Uganda, for achieving this, and to wish you the best of deliberation. Thank you so much.
Thank you very much, Dr. Dungu. Dr. Dungu, you have spoken extremely well. As we wait for our chief guest to come, I would like just to state something that is a sweet moment for palliative care today. Today is the birthday of Hospice Africa Uganda, and we would like to just say happy birthday to Hospice Africa Uganda. Hospice Africa Uganda is a non-profit charity that was founded by Dr. Anne Merriman, and has been here for 28 years offering services to some of the neediest patients who need the service. I would like to take this opportunity to invite Dr. Jackson Amone, who is the Commissioner of Clinical Services at the Ministry of Health, to say a few words at this international conference. Thank you very much. You're most welcome, Dr. Amone.
Yeah, thank you so much. Here on this session, a representative of the Minister of Health, the Director of Uganda Cancer Institute, the Country Director of ICAO, and the Chair of Board of Palliative Care Association. Participants both in the House and those who are virtually attending this conference. It is really indeed a pleasure for us to be here, especially on behalf of the Department of Clinical Services. I'm happy to speak after my two colleagues from the Cancer Institute and from Palliative Care Association have spoken. You know, now we are getting a huge burden of diseases. We are having emerging and re-emerging disease conditions, and these are not easy. We are continuously adding on new diseases, especially 2 years ago we added in our vocabulary COVID-19, and these are not easy. And there are many non-communicable diseases which are on board. As we treat COVID-19, you know there are a number of comorbidities, which includes cancer, diabetes, sickle cell, hypertension, cardiac conditions, which are making the treatment of COVID-19 very complicated. And associated with this, we have a number of chronic conditions which we are facing. And many of these non-communicable diseases are of chronic nature. And patients will be in our care for a very long time. Others are having very sick conditions. They are always in pain. And as we manage them, we want to see that we alleviate their suffering. We reduce the pain in which they are in. And this we can do it working together with our colleagues from the Palliative Care Association of Uganda. As a ministry and as Department of Clinical Services, we have really been striving to ensure that palliative care services are available in most of our health facilities, from the lowest level to the highest level, because each of us who are here and those who are attending to us virtually, you will at one time or another need palliative care. Cancer is on the rise. People are very sick, and they will definitely come to you. So my advice is one, that we are happy today, we are talking to you. We are sensitizing you that these chronic conditions are there. A number of these conditions will affect many people. And we are giving you a sensitization that as you get these conditions, palliative care services are available. So my advice is that, one, you must have a good health-seeking behavior. If you are sick, please report early to the treatment facilities. so that we can investigate you early, we make a diagnosis early, and when we do that, the treatment may be cheaper, and then immediately we can enter you into care, which may improve your life, and you may live longer with the disease condition which you have. So I want to thank the organizers for this. Clinical services have been part of this arrangement for the last 3 years, and we pledge that we will continue to be part of this Uganda Cancer Conference on Care and Palliative Care, which is organized jointly by Palliative Care and the Cancer Institute, but with a lot of support from the Ministry of Health. So I thank you, I thank my colleagues who have spoken before me in this conference. Thank you, and over to you, Chair.
Thank you very much, Dr. Mone. You have ably highlighted the role that curative services and clinical services, palliative care, and also the care of cancer patients intertwines, and how we are all together in the process of care, the circle of care for patients. The kind of patients that receive cancer care and palliative care is unique because, unlike many illnesses that are short, malaria can be a short illness, cancer can actually be a long, protracted illness, needing all kinds of modalities of care, and needing a multidisciplinary team to be able to attend to all the domains that require care: the physical, the social, the psychological, the spiritual, practical aspects, cultural aspects, and in all this, the patient is never alone. The patient is in the context of a family, and the family is in a state of suffering themselves as the patient is. So I would like to just highlight once again that we are extremely grateful to the Ministry of Health, which has not let down cancer care and palliative care. Ladies and gentlemen, those of you in the studio, online and on TV, we are still waiting for our guest of honor to arrive, and he will be here soon. He will be here soon, and once he's here, we will very quickly have the official opening of the conference, and of course the addresses from the dignitaries will follow as in the program. Thank you very much for your kind attention.
Ambassador, I'm here to inform you that Uganda Cancer Institute, together with the Palliative Care Association of Uganda, in partnership with the Ministry of Health, will host the 3rd Uganda Conference on Cancer and Palliative Care on 23rd and 24th September 2021. The theme of the conference is Cancer and Palliative Care in COVID-19 and Other Challenging Situations. This year's conference is a unique one, and will be held virtually, with some sessions broadcast live on UBC TV. We will have panel discussions, plenary sessions, and workshops, as well as presentations of abstract, where scientists will share latest research on cancer and palliative care. This conference will bring together at least 400 policymakers, researchers, health providers, patients, and the general public who will be watching online. I encourage you all to register for this important event. Registration for Ugandan delegates is 200,000 shillings.
For more information, call 0392 080 713 or 0414 540 410. Email conference@uci.or.uj or conference@pcau.org.uj.
Getting GoTV was the best decision James has ever made. Finding a good place to watch football was never easy, but it was costly until James discovered something big. Now he can finally enjoy the benefits of homegrown advantage with a decoder and 1 month of GoTV value. For just 25,000 shillings, enjoy the world's biggest leagues and cap competitions. GoTV Uganda, love it.
The Uganda Cancer Institute, together with the Palliative Care Association of Uganda, will host the 3rd Uganda Conference on Cancer and Palliative Care from the 23rd to the 24th of September 2021 on the theme Cancer and Palliative Care in COVID-19 and Other Challenging Situations. The conference will be held virtually with some sessions broadcast live on UBC TV plus workshops at hospitals to bring together at least 400 stakeholders. The Prime Minister of Uganda will be chief guest at the opening session and there will be a keynote address by the Director General of the World Health Organization. To participate, register through https://conference.uci.or.ug/ at 200,000 shillings only for Ugandan delegates. Upcountry delegates will attend through satellite facilities at regional referral hospitals, hospices and palliative care organization centers and referral cancer centers. For more information, call 0392 080 713 or 0414 540 410. Email conference@uci.or.ug or conference@pcau.org.uj.
My home, I smile when I think of you, Uganda. My home. My home, I dance when I look at you, Uganda. My home, oh my Uganda.
I know, with you I'll always stay forever. I know, because I feel that we belong together. My home, under the sun so bright, under the moon at night, on my heart, mommy, oh my Uganda.
Hey mama,
My Uganda. My Uganda. My Uganda. My Uganda. Nikukunda. My Uganda. Amari alemira. My Uganda.
nyowe nikugonza.
My Uganda.
Amina ngojo, Amina ngojo.
At MTN, we look forward to starting another exciting journey together to grow our home, Uganda.
Oh, Uganda, may God uphold thee. We lay our future in thy hand. United, free, for liberty, together we'll always stand. Oh, tuilinde Jumuiya Afrika Mashariki, tuwezeshe kuishi kwa amani, tutimize na malengo yetu. Jumuiya yetu sote tuilinde, tuajibike, tuimarike. Umoja wetu ni nguzo yetu, idumu jumuiya yetu.
Let's stay standing for a word of prayer. Is Dr. Ekiria Chikule around? Yeah, okay. Okay, let's humble ourselves and pray. Father, we thank you for this day that you have created, that you have made. Thank you for bringing us to this third conference on cancer and palliative care. Thank you for leading us all through the time of COVID. And we're here today to give testimony of your goodness to us. Thank you also for making this conference happen. And at this conference, we shall be saying the goodness that you have been to us, mankind, and the lessons that we have learned. So we give you honor and glory. In the name of the Lord, we have prayed. Okay. The right Honorable Second Deputy Prime Minister, General Moses Ali, the Honorable Minister of Health, represented by Dr. Charles Olaro, who is the Commissioner of Curative Services, Minister of Health. Our keynote address speaker, Dr. Tedros, the Director General of the World Health Organization, chairpersons and members of the boards of Uganda Cancer Institute and the Palliative Care Association of Uganda, conference delegates who are online, here in the studio and on TV. Ladies and gentlemen, good afternoon to you. And you are most welcome to this international conference on cancer and palliative care. My name is Dr. Eddie Mwebesa. I'm a palliative care physician and also the Clinical and International Programs Director at Hospice Africa, Uganda. I am honored to be the co-chair of this conference. Ladies and gentlemen, the last 2 years have been very, very atypical, and that is the reason that we are having this conference with this theme, cancer and palliative care in COVID-19 and other challenging situations. We have been blessed to have the dignitaries on the podium today, and all of you who are in the studio, online and on television, attending all over the world this international conference. It is now my honor and privilege to invite the country director of the Palliative Care Association of Uganda to invite that the address by the World Health Organization Director General is played. Please.
So much, Chair of the conference. Our chief guest, General, thank you so much for coming. We are delighted to have you. And we had gone through the protocol. I'd like to say that this is a special conference, once again, and that we have many people who have been online, and some of them who are on TV. And we thank you for your patience. And at this moment, we thank you so much because we have our chief guest in the house, and so he will be addressing us very soon. I'd like to take just 1 minute Right Honorable Prime Minister to mention that the Palliative Care Association of Uganda is a membership organization for all palliative care providers in this country. And palliative care, as you will listen, because we will invite Dr. Rem to speak later, and I hope he will mention more about this and why it is important that this is integrated in cancer care, is an approach that is used to relieve pain and suffering among people. And these we mean individuals, children and adults who have severe health-related suffering as a result of disease or long-term illness. And so this approach covers a range of interventions, and some of them are physical, to deal with the pain of the person that they have because of the disease. Some of them are social. The interventions are social, to deal with the social pain that comes up with somebody who is unwell or sick, covering from a long-term illness. And so we talk about, for example, the example we usually give, I normally say, a lady who has children and is suffering and is near death, concerned about the plight of his children once they pass on. We talk about psychosocial, or things that are social but also of the mind. And we also work with people of mental health closely. And we talk about spiritual. And there are spiritual interventions that we talk about. And so we have spiritual care. Somebody who has a long-term illness or who has severe health-related suffering may ask, why me? Why has God neglected me? We are delighted that you are able to come and to make it to this meeting. And we know that now that you have joined us, you have always been with us, you'll even subscribe to become a member of the Palliative Care Association of Uganda. And in this house, we have people who have been there since the service started. We have representatives of Hospice Africa Uganda, and we even have the Chief Executive Director. She's out there. She can stand up for recognition, because it is through Dr. Anne Merriman that this service was coordinated, and we've been having them. She's there. She's Dr. Dorina Gasha. We have Rose Chiwanuka. She was the first palliative care nurse in this country, and she was the founding country director of the Palliative Care Association of Uganda, and she's right here in front. We have people who have organized the conference. The gentlemen here, Dr. Innocent Mtiaba and Dr. Eddie Mwebesa, are the chairs for organizing this conference. And we have our chair of the board of the Palliative Care Association of Uganda, Dr. Henry Dungu. He's up front there, and you must have heard about him. I want to mention a special category of people. Of course, the members of the board, some of them are here. These are life members of the Palliative Care Association of Uganda. Right Honorable Prime Minister, the association depends solely on donations and people who give us funds from abroad, but also individuals who contribute to this country, to us in this country. In this meeting, we have 2 life members of PICAO, and these are people who have, actually there are 3, people who have paid in 1 million Uganda shillings to support the work that we do, so that we are even able to partner with the government of Uganda through the UCI that we have having together this conference. So I take the privilege to introduce them to you in a spirit of encouraging all of us here to subscribe to support the work of PICAO. And one of them is our board chair, Dr. Henry Dungu. The other one is Ms. Rose Chiwanuka, who's also a subscribed life member of PICAO. And the last one is Dr. Jackson Amone, who is a commissioner in the Ministry of Health and is also a life member of PICAO. We've had the program run as it is in the booklet provided to everybody who is a conference delegate. I can't go through that. And I pray that we move on from this moment going forward. I invite the executive director of the UCI to invite the chief, to acknowledge the presence of the chief guest. After that, he will invite the minister to speak, and the chief guest will speak to us. In that order, allow me to take the privilege to invite Dr. Rem, a colleague and friend who has been instrumental in this partnership. Thank you.
Our chief guest this afternoon, the Deputy Prime Minister, General Moses Ali. It gives me great pleasure to have you here this afternoon. And I want to start by recognizing, of course, the presence of the representative of the Minister of Health, in the person of Dr. Charles Olaro, who is a director at the Ministry of Health in charge of curative and clinical services. Ladies and gentlemen, Mr. Misiga has stated the importance of palliative care, and then also about the collaboration existing between the Uganda Cancer Institute and the Palliative Care Association of Uganda. And of course, he has implored our chief guest about the important role that palliative care fraternity are playing in the country, and also invited him to become a member. What I can tell you is that General Moses Ali is one of the strongest supporters of cancer services in the country. And I'm stating this without any doubt, and I'm very sure, because of the association and the interest that he has taken in the development of cancer services in the country, I'm very sure by default he's also going to take on board the activities of palliative care. In as far as the role, the linkage that we have between palliative care and cancer services is concerned, our chief guest, our role is to make sure that we care for the patient holistically. And in caring for the patient holistically, there are two parts of it. There is handling the disease, and then there is also handling whatever else come about as a result of the disease process or as a result of the treatment itself. And these are usually called symptoms, and some of them can be very disabling. So in order for us to look after patients holistically, we decided that working with palliative care fraternity is the best way, so that the symptoms are handled by specialists in symptoms, and then the disease is handled by specialists in the disease. And if you combine these two together, then you'll end up having looked after the patient completely, in the sense that the symptoms are handled, the disease process is also handled, you restore the function of the patient to where it should be. That is why there is no point fragmenting what we do. We must work together, but different specialties. And that is the essence of this conference. As you have heard, we are coming up with new ways, new innovations through research that we would want people to know. And this conference is the avenue through which we can do that. So once again, I want really to take this opportunity to warmly welcome you for this conference. And I think you have really demonstrated what I've just said, that you are a keen supporter of cancer care in this country, because otherwise you would have thought of going maybe for some other activities, but you decided to be with us. And with that, I would want now to take this opportunity and a singular honor to invite Dr. Charles Olaro, who is going to speak on behalf of our Minister of Health, to come and address you. Dr. Charles Olaro. Thank you.
Our guest of honor, the Right Honorable Second Deputy Prime Minister, General Moses Ali, the WHO Director General, Dr. Tedros, who gave the keynote address, the Executive Director of Uganda Cancer Institute, the Country Director of Palliative Care Association of Uganda, the Chair of the Board of PICAO, all the awardees, both institutional and individual, and the board members of PICAO and also of Uganda Cancer Institute, government officials, distinguished speakers, and all the guests, all the delegates who are here physically and those who are attending virtually, the media, ladies and gentlemen. Right Honorable Prime Minister, it's with my much pleasure that I welcome you to this third conference on cancer and palliative care under the theme of cancer and palliative care in COVID-19 and other challenging situations. I want to bring the apology from Honorable Margaret Muhanga, who was supposed to officiate. She had to go to Entebbe to receive the COVID-19 vaccines. So my responsibility, Right Honorable Prime Minister, is to read her speech. This conference comes at a time when the cancers are on the rise in Uganda and around the world, and subsequently there's a growing need for palliative care. There's also a lot of emerging and re-emerging infections, including COVID-19, which the entire globe is currently battling with, Uganda inclusive. Uganda also suffers from a double burden of disease with a high prevalence of both communicable and uncommunicable diseases. So in order to achieve universal health coverage, there's need to focus on promotive, preventive, curative, rehabilitative, and palliative care. The ministry, working with the Ministry of Public Service, undertook a restructuring of the Ministry of Health, in which a division of palliative care was created at the Ministry of Health in the Department of Clinical Services, which is headed by the Commissioner, Dr. Munich. And once these staffs at division are recruited, the advert are already been made, people were shortlisted. I think the interviews are also were done. So we're waiting. This will steer the palliative care services in the country. Our guest, the ministry, also created positions at the level of a senior consultant, and medical officer special grade in Kirudu Hospital and Kawempe hospitals. Even the draft structure of the regional referral hospitals, we have created positions for specialists in palliative care. And we think that this will go a long way in taking the palliative care services in this country. The government of Uganda, in partnership with the Palliative Care Association of Uganda, Hospice Africa, and African Palliative Care Association, are training palliative care specialists, including nurses, allied health professionals, up to the level of master's degree in palliative care. Currently, PICAO is providing scholarships in advanced diploma in palliative care, and we really sincerely appreciate this on behalf of the Ministry of Health. The Cancer Institute has been designated as a center of excellency in cancer care, research and training in the region, and the Institute is now training a variety of specialists, health professionals in different fields of cancer care for the country and for East African countries, with support from Government of Uganda and the African Development Bank. Right Honorable Prime Minister, in terms of pain management, the ministry has been importing morphine powder through the Hospice Africa, Uganda. This then reconstituted into liquid oral morphine, which is sent to national medical stores and joint medical stores, which now does distribution to all health facilities offering palliative care services in the country. The government has also supported the Uganda Cancer Institute to improve high efficiency in procurement of cancer drugs, medicines, and supplies. And I'm happy to announce that the availability of cancer drugs at the Institute now stand at about 90%. Probably we need a big clap for Cancer Institute. The cancer services are being decentralized through the establishment of regional cancer centers, which include Arua Regional Cancer Center, Gulu Regional Cancer Center, Mbale, and then Barara Regional Cancer Center. This is intended to improve access to cancer services in the country. And the Right Honorable Prime Minister, you recall the senior, your colleague, the senior Right Honorable Prime Minister, laid the foundation stone for the building of the Regional Cancer Center in Gulu. And this is ongoing, and we expect in 12 months this center will be up and running. The Ministry of Health has been working with all the other stakeholders, including Palliative Care Association of Uganda, and we have developed a palliative care policy, which will soon be presented to Cabinet for approval. It's really our sincere appeal that when this policy is approved, it will be the basis of palliative care provision in this country. Since this conference focuses on key priority areas above, the Ministry of Health is confident that this will enable the population to have a better access to cancer treatment and palliative care services during this COVID-19 pandemic. I've said this on behalf of the Honorable Minister of Health for God and my country. The Right Honorable Prime Minister, it's now my singular pleasure to invite you to give your address. Thank you very much.
First of all, down there. I first of all want to ask for you to allow me to speak as I am speaking now. Two, I'm representing the Prime Minister. Therefore, what you hear is actually his speech, because I've come to get it late. UBC must be the first in the country to know or to observe my absence in the country. I've just come 2 days ago. I came back on Sunday. I went away. I was out for some few days, some 51 days I was away, went for treatment. So I'm back, and I'm happy that God has heard your prayers, and I received the treatment. Thank you, God. Among the problems I have, not cancer. Otherwise, my poor friend here will be in the first to be in problems. So you don't mind me addressing you here. Secondly, I must also say I am involved. Cancer, he can witness me. I've been visiting him at a long time, many times. As a Muslim, one of my madam, I lost my one of madam to cancer, I remember. I was taking her to India. The second time she died in Dubai. Cancer, she was brought back, and so cancer is not new to me. I am reading this, I'm telling you this out of the Prime Minister's speech. I don't think he would have put this in his speech. So I'll tell you that. Therefore, because of personal problem with cancer, I also got to be involved with this young man. I think he must be younger than I've been involved with him. I've known him very well and very long time. This palliative, cancer palliative, I don't know. Actually, I'm part of it. Whether and nobody going to stop me from being there because I know the problem of cancer. Yeah. So anybody having cancer is the same. You know, you don't have to be different. So this is a place and a situation where attention must be paid. And that is what I only want to say as my partner. That's why I'm saying it as it is, not part of the speech. So I'm going now to read the Prime Minister's speech. The Honorable Minister of Health, the ministers present, members of Parliament present, chairpersons Board of Directors of UCI and the PCAU, executive directors of Uganda Cancer Institute and the PCAU, distinguished guests, ladies and gentlemen. I don't know whether this thing is effective. Is it? It gives me great pleasure and joy to speak to you on this important occasion, scientific conference on cancer and palliative care, where researchers are sharing experience, knowledge, and information on cancer and palliative care. I have been made aware that the theme of this conference is cancer and palliative care in COVID-19 and other challenging situations. Indeed, COVID-19 pandemic and its restrictions to mitigate the spread of the disease have affected many economies. However, all this has not affected the conference to take place. On this note, I would like to take this opportunity and thank the organizers of this virtual scientific conference for making it a success. This scientific conference on cancer and palliative care presents an opportunity to key stakeholders such as researchers, policymakers, donors, development partners, and the governments to share information and draw strategies aiming at cancer prevention, research, treatment, and palliative care. Cancer affects individuals, families, society in many ways, socially, financially, economically, and politically. Therefore, any effort geared towards the cancer fight is worth supporting. These statistics available clearly show that cancer burden is on the rise, both in adults and the children. Over 6,000 patients are seen at the UCI, Uganda Cancer Institute, annually, yet out of these patients, the survival rate is still below 20% due to amalgamation of many factors ranging from availability of modern diagnostic equipment, availability of adequate and quality anti-cancer medicines, adequate skilled human resource, adequate financing for cancer services, among others. These factors affect the outcome and survival of cancer patients. The government of Uganda and Parliament in particular in the recent years has tried to put some impetus in advocating for improvement of cancer care in Uganda. This has been done in the following. A. Enacting the Uganda Cancer Institute Act of 2016, Act number 19, which gives autonomy to the UCI, Uganda Cancer Institute, with a mandate to undertake and coordinate the management of cancer and cancer-related diseases in Uganda, including procurement of highly specialized cancer medical supplies and equipment. B. Prioritizing access to cancer services in the National Development Plan 3 and establishment of regional cancer center in 4 regions in Uganda at Arua, Mbarara, Mbale, and Gulu. I think we should clap to the government. At least. Thank you. C. Positioning Uganda Cancer Institute as a medical tourism destination in the region so as to reduce cancer patients referrals abroad. D. Improving gradually on the budgetary allocation for cancer services within the available resources, although the budget has not reached the desired levels. There has been some significant increase in the budget for the Institute. E. Creating a division of palliative care as the Ministry of Health, which has facilitated the proper coordination of palliative care activities in the country. F. Covering the cost of palliative care medicines as listed in the essential medicines and medical supplies list. G. Advocating from development partners for additional resources for supporting the Institute. For instance, in 2020, the Parliament of Uganda approved a loan from Austria to support the Institute in establishing a regional regional cancer center in northern Uganda, an initiative to fight against non-communicable disease in the region. The government will continue to support Uganda Cancer Institute and the Palliative Care Association of Uganda in many more areas that targeting improvement of patients' care at UCI and the country at large. You people who are not clapping, you never know, in case now we are talking, you're also having cancer. Until you come to know, go there to some machine, go and tell you that you have, then that's not you will be clapping. You clap whether you have it or not, please, for the sake of others. As we attend this conference and continue to care for cancer patients, we should also note that the World Health Assembly in May 2017 and at its 70th sitting in Geneva, Switzerland, countries were called upon to invest in cancer, a leading non-communicable disease killer. Before that, the World Health Assembly in May 2014 had made a resolution on palliative care, calling upon countries to integrate palliative care services into the entire continuum of care and treatment. The government is committed to fulfilling these solutions. Cancer is estimated to cost world economies as much as US $1.16 trillion annually. I don't know how people can imagine. This is a lot of money. A figure that is projected to grow exponentially if action is not taken now to reduce the spiraling growth in the number of access, the cases and the impact on both individuals and healthcare budgets. The government is committed to support the institute financially so that the cancer burden is reduced. The 2017 cancer resolution is a direct response to this challenge, providing countries with the guidance for change from health promotion and risk factor reduction, with the particular emphasis on the tobacco control policies laid out in the WHO Framework Convention on tobacco control and anti-cancer vaccines, but also the need to address inequity in access to early detection, timely and appropriate treatment, including pain relief and palliative care. The Parliament of Uganda has already enacted a law on tobacco control as a way of tackling the cancer that are a result of smoking. As a country, Ministry of Health and the Uganda Cancer Institute, we need to invest heavily in one, early diagnosis programs for the common cancers, that is cervical, breast, prostate, colorectal, and oral cancers. Which is oral cancer? The mouth. Oh, okay. B, development of partnerships, referral networks, and of centers of excellence for improving the quality of cancer diagnosis, treatment, and care services, and facilitating multidisciplinary cooperation. C, training of health professionals at all levels of health care, and strengthening of palliative care and promotion of cancer survivors, follow-up and rehabilitation. There are many things we can do individually to reduce our risks for cancer. We need to adopt a healthy lifestyle through regular exercise, healthy diet, and by staying smoking free. Today, I would like you to focus on the importance of making it a habit to go for regular screening for breast, cervical and colorectal cancers. For these cancers, there is good evidence that early detection and the treatment will be able to save lives. Because cancer, when detected and treated in the early stages, has better outcome. This is very important to us. In conclusion, I wish to call upon all stakeholders, civil society, organizations, individuals, researchers, and everyone present on this virtual conference to join hands and combine effort in the cancer fight at all levels. The fight for cancer is for all of us. We need to join hands and fight this monster if we are to reduce the cancer burden. I wish all presenters, all the presenters, researchers, and policymakers attending this conference a fruitful and successful conference. Thank you for attention. Thank you for your attention, and the conference is now officially closed for God and my country. Some people are not typing since are not clapping since I started speaking. And I wish you good. Let God help you. Is that the thing? Yeah, I finished.
Thank you so much. You're very grateful to the Right Honorable Second Deputy Prime Minister. Our conference is now open. We shall end the ceremony with the national, starting with the East African anthem and then end with the national anthem. Yes. Okay. Thank you for the guidance. Let's stand up, please.
Afrika Mashariki, tuwezeshe kuishi kwa amani, tutimize na malengo yetu. Jumuiya yetu sote tuilinde, tuajibike, tuimarike. Umoja wetu ni nguzo yetu, idumu jumuiya yetu.
Oh Uganda,
Thank you so much. We shall have a group photo outside in front of UBC studios. So please just gather there. And after there, someone will communicate the lunch arrangements.
Cow Goodwill Ambassador, I'm here to inform you that Uganda Cancer Institute, together with the Palliative Care Association of Uganda, in partnership with the Ministry of Health, will host the 3rd Uganda Conference on Cancer and Palliative Care on 23rd and 24th September 2021. The theme of the conference is Cancer and Palliative Care in COVID-19 and other challenging situations. This year's conference is a unique one and will be held virtually with some sessions broadcast live on UBC TV. We will have panel discussions, plenary sessions, and workshops, as well as presentations of abstract, where scientists will share latest research on cancer and